Good morning. Myself, Dr. Keshav Chandra Mandal. I am doing a research on the consciousness level of people in India and its socio-economic and political effect on India. All right. I and a professor of a university, both of us are doing this research, and I personally, as a part of that research, I am keeping a track of the situation of COVID-19 in India, how this coronavirus is advancing in India, what is the effect, and how many people are getting infected every day, how many people are getting infected, and how many people are dying in India. I'm just keeping a track since 8th of April. I have been keeping this track. You can see here that on 8th April, I found that confirmed cases of COVID-19 were 5,194 in India, 5,194 only, and total deaths were 149. Only 149 people died on 4th April 2020. You see what happened after 7 days, 8:15. So if we take on 15th, what happened on 15th? On 15th, if we look, we'll find that from 5,194 to it increased to 11,439. So the number of infected people got doubled. You see, isn't it? So it was on 8th, it was 5,194, whereas on 15th, it became 11,439. And the difference you can find that 1,076 people, I mean every day, average more than 1,000 people were getting infected by coronavirus in India. And total deaths also, it became more than double, because on 8th April it was 149, but on 15th April it became 377. You can see that average every day about 35, average 35 or approximately 30 people were dying. So in this way, total increase of coronavirus death cases became in India 377 on 15th April 2077. Again, after 7 days, if we consider the situation on 22nd April, what happened on 22nd April? This number does not doubled within this week, though the figure of infected persons may not be doubled, but it became almost double, 19,984 cases, according to WHO. I am telling the figures on the basis of the WHO report. All right. So because every day I am noting down from the website of WHO. So on 22nd April, I found that 19,984 people have been infected in India, and out of that, total death cases also increased to 1,383 on 22nd April. And sorry, this is the difference. But the number of death cases increased to 640. Number of death cases increased. It was on 15th April, it was 377, but after 7 days, on 22nd April, it became 640. It became 640. It means, though not double, but approximately more, you can say 300 plus 300, more than 300 people have been added within this week, death cases. And then if we come to 22nd and then 29th, not reflected the same report. But if I consider the rate of 30th April, what happened on 30th April? 30th April, if we go to 30th April, from 15th April to 30th April. It means within a fortnight in India, COVID-19 infected cases doubled, more than double. The number of infected persons became more than double, because it was on 15th April, it was 11,439, whereas on 30th April the number increased to 33,050 number of people got infected by COVID-19 in India, and the total number of death cases also became 1074. So in this way, if we find that every week the number of cases are increasing about almost double, nearly double. So this is really a situation where we should keep we should be more conscious. We should maintain social distancing, and we should wear mask, and we should not go out without emergency, or if we do not have much importance, if we do not have very urgent work, we should not go outside. But the people, the people who are in essentials, who are engaged in essential services such as doctors, nurses, medical staff, and hospital staff, and the cleaning people, and scavengers maybe, and the carriers of essential goods in trucks, matadors, and the people, and the police force, and with the teachers also sometimes, because we had to go to school for distributing potato and rice that was ordered by the government of West Bengal, and we did it. In this way, the people who were engaged in essential services should only go out. Otherwise, all the people should stay home. Please stay home, because yesterday I saw a news in a television channel that when the government of West Bengal gave relaxation or opened wine shops or liquor shops, you will find that hundreds of people stood in the queue for getting bottles of wine. So this is very horrible, and this is very government of India or government of West Bengal should think about that, because thinking or considering them, a lot of people as poor, as unfed, the government is providing food to them. The government is giving free of giving food for staff, sometimes rice, and sometimes potato, and dal or lentils, or what is the flour and atta and wheat, free of cost. And many people, many NGOs and many kind-hearted people are also helping the poor people, so that they can eat, or so that they can at least survive. But what we saw yesterday in Kolkata, not in Kolkata, in entire West Bengal, that as soon as the wine shops opened, people stood in queue. Maybe more. Sometimes it became 1 kilometer or long, or sometimes the length of the queue became sometimes more than 1 kilometer. Can you imagine? After taking ration from free of cost, free ration from ration shops, or from government counters, they are coming to the wine shops for buying wine. What is this? So government should think whether they should provide, or whether they should give food stuff to all the people free of cost or not. Government should reconsider it. Right? Okay. Now let me tell you the latest situation on 4th. Today is 5th. Yesterday at night, I counted. On yesterday night, I saw that the number of infected people in India became 42,533, and the total death cases were 1,373. This is the situation in India. And this is not good. 1,373 people. I don't know whether it is fair enough or not. but still we should believe in that with the government reports. And if we consider that this number of people are dying from COVID-19, and so this is, and the number of infected people is also growing day by day, and it is really a matter of concern. So all we should be careful, and also all we should abide by the by the rules, and the what is the guidelines that have been provided by government of West Bengal and the government of India, right? So we should take care of it. We all should abide by laws, right? Thank you very much. Thank you. Okay, thank you.